I care for all types of issues and conditions, and also do surgery, and some of which we will be talking about today. But one of the things we'll be talking about is prescription issues with children related to increased globe length. We will also be talking about ectopia lentis, which means it's a subluxation or dislocation of the lens within the eyes. Briefly talk about cataracts, amblyopia, strabismus, which is also called squint or a misalignment of the eyes. Briefly, a little bit of glaucoma, and then finish up with retinal detachment. So I know you've had quite a few talks today about Marfan syndrome, so the genetic side has already been discussed probably at length. But the main thing is that the Marfan genetic mutation involves the fibrillin-1 gene, and that gene plays a large role in the eyes and parts of the eyes. So fibrillin, it affects the cardiovascular system, the skeletal system, respiratory system, and ocular system, which is what I will be focusing my discussion on. So for fibrillin in the ocular system, it actually is a component of many parts of our eyes. The conjunctiva, which is the clear, transparent layer over the white of the eye. The cornea stroma, which is the clear cap on the cover of the eye. The endothelium of Schlimm's canal, which is actually part of the drainage system in the front portion of our eye. The sclera, which is actually the white portion of the eye. The choroid, which is a deeper layer of the eye. And then lastly, something called ciliary zonules, which is what suspends and holds the lens inside our eye in place. So the first thing I'd like to go over is prescription errors in the eyes. And why do people need glasses in general, not just an individual with Marfan syndrome? So what makes someone need glasses? Well, it has to deal with the focal point on the back of the eye. This is the point where the lens and cornea focuses things onto the back of the eye. And you can see in this top picture, these rays of light that come through the eyes and focus on the exact portion in the back of the eye. When it meets in the retina, in the back of the eye, in the exact right space, this is considered a normal vision. No one needs glasses. However, someone that is farsighted, also called hyperopia, that means the focus point is behind the back of the eye. And you can see here that this portion, the focusing point in the back of the eye, is what causes things to be blurry if you're hyperopic. And then, which is the case for many patients with Marfan syndrome, myopia or nearsightedness means the focus point is in the front of the eye, which you can see at the bottom here. Lastly, a third component of prescription is called astigmatism. And this means there is a prescription difference in one direction compared to the other. And it is sort of an orientation of the prescription in the glasses. And when we do wear glasses, what that does is it changes the focus point for the eye so that it brings it into the set normal focal plane in the back of the eye, which you can see on the boxed in area here. So the point is with glasses or contacts is that it changes how things are focused in the eye so that they are clear